And a very good morning to you. It is Rhema Brekky. Good to have you on board. And our very special monthly guest is joining us. Our resident medico, Dr. Clara Chu, is in with us. Good morning to you, Clara.
Yeah, good morning, Mick. How are you going?
I'm going really, really well. Good to have you on board. It is a big one, of course. Now, during the month of September, which is what we're in at the moment, Women's Health Week is being held from the 2nd through to the 6th. And this morning we're going to be looking at one of the major issues of health in the ladies, and that's menopause. Now, can you start by telling us what exactly is menopause?
So menopause is when a woman has her final menstrual period. So her period stops because her ovaries are not releasing any more eggs. And we refer to the time leading up to menopause as perimenopause and the time after a woman's final period as postmenopause. So when a woman's had no periods for 12 consecutive months, she's considered to be postmenopause.
So what age do women usually begin to experience menopause? Because I've heard of, early and late onset menopause.
Yeah, so in Australia, the average age of menopause is 51 years. But it's normal to have menopause anywhere between 45 and 55 years of age, although some women can have it at an earlier or an even later age than that range. So if a woman has had both her ovaries removed through surgery, we refer to this as surgical menopause, and this can obviously happen at any age. A woman may also undergo premature menopause or premature ovarian insufficiency, so a bit of a mouthful there, before the age of 40 because her natural ovarian function stops, or because of something like chemotherapy or radiotherapy. So medically speaking, we consider menopause to be early when it happens between the age of 40 and 45.
So what happens exactly during perimenopause?
Yeah, so as mentioned earlier, perimenopause is the stage before a woman's final period. So it's when her body reaches the end of its reproductive years. This is a natural part of a woman's life. We ought to be expecting that to happen.
Yep.
Now, it usually happens sometime in the woman's 40s. On average, it lasts for 4 to 6 years, but it can last anywhere from 1 to 10 years. So, a massive range there. And during this time, the ovaries will begin to run out of eggs, and this can cause hormone levels, particularly estrogen, to fluctuate, which can cause different symptoms like hot flushes, mood swings, those kind of things. Now, the changing hormones can also affect the menstrual cycle. So, for example, a woman's period may become irregular, it can become shorter or longer, lighter or heavier, or they may not come at all for a few months. So, the way that I explain it to a lot of my patients is it's like puberty, but in reverse, because that's kind of what happens when you first start getting your periods and you start ovulating. Now, some months the woman may ovulate and other months she may not, and she may even ovulate twice in a cycle. So, you can see that it's just all over the shop and can become a bit quite distressing for people. Now, at this point, I think we should mention contraception. Mm-hmm. Even though fertility is lower in someone's 40s and 50s, it is still possible to become pregnant naturally. This is because sometimes ovulation can still happen. And so the chance of pregnancy in women aged 45 to 49 years is around 2 to 3% per year.
That translates to a few women there.
Yeah, correct. So after the age of 50, it's less than 1%. Mm-hmm. So, once you hit 50, you can probably safely say you don't need any contraception. So while this is very low, every woman's fertility is different. So we can't just go off the stats and just go, oh, that's not going to be me. So if any of our female listeners don't want to become pregnant, towards that menopause period, they should continue to use contraception until they've either had a year without a natural period if they're older than 50, or 2 years without a natural period if they're younger than 50. Now, menopause hormone therapy, or what we used to call hormone replacement therapy, is not a contraceptive, mm-hmm. and women should not rely on that to prevent pregnancy.
Yeah, some good points there for sure. Now, what are the most common symptoms of perimenopause and menopause?
So there are lots and lots of symptoms. So I'll break them down into physical symptoms and psychological and emotional symptoms. So in terms of physical symptoms, a lot of women would have heard of this: irregular periods, hot flushes, night sweats, sleep problems, sore breasts, itching or crawling or dry, crawling sensation on the skin or dry skin, feeling exhausted and fatigued, a dry vagina, a loss of sex drive, mm-hmm. Headaches, migraines, aches and pains, bloating, urinary symptoms, weight gain due to a slower metabolism. So there's a whole heap of things there from a physical perspective. And then if we were to move on to the psychological and emotional symptoms, we may notice that we start feeling a bit more irritable and frustrated, feeling anxious, difficulty concentrating. A lot of people tell me about their brain fog, their forgetfulness, mood swings and a lower mood, and also just that general feeling of not being able to cope as well as you used to be able to.
Yeah, now we need to ask this one. So how long can the symptoms last, particularly with the dreaded hot flushes?
Now, before I answer that question, you might be interested to know that about 20% of women have no symptoms at all. 60% can have mild to moderate symptoms, and it's the remaining 20% that we hear about, right? So you can imagine my work as a GP. If every woman who goes through menopause has symptoms, that's probably all I'd be seeing all day, and they'd be clogging up the entire health system, right? So we're talking about the 20%. And they're the women who have severe symptoms that interfere with their daily life. So, it can be influenced by all different things. So, for example, your stage of life, general health and well-being. Some symptoms will start during perimenopause and continue all the way into postmenopause. And so, some Australian studies have shown that women can experience symptoms like hot flushes and night sweats well into their 60s. But that's thankfully not everyone.
Yeah, absolutely. Just that small minority is what you want to try and keep it at.
Yep.
We are speaking with our resident medico, Dr. Clara this morning. Very, very big topic for the ladies out there on menopause. We'll take a break and we'll be right back after this. Welcome back. It's Rhema Brekky, and it is a huge one today. We've got our resident medico, Dr. Clara in with us this morning, and we are chatting about menopause. Now, moving on this morning, Clara, from a general health perspective, now what changes after menopause for a woman?
Good question, because aging and lower levels of estrogen can increase the risk of developing certain health conditions. So it becomes more important for us to look after our health after menopause. So in particular, there are a few areas that I would like to draw listeners' attention to. So they are the heart, the bones and osteoporosis, weight, the bladder, the gynecological system and the breast. So there's a few things there. But let's start with the heart. Now, before menopause, women generally have a pretty low risk of heart disease and lower than men usually. But as a woman age and their estrogen levels fall, their risk of cardiovascular disease actually increases. And heart disease is one of the leading causes of death for Australian women. So in fact, it claims 3 times as many lives as breast cancer.
Wow.
Yeah. So we want to make sure that women stay on top of their blood pressure, their cholesterol levels. So they're both major risk factors for developing heart disease. And of course, we know that we can reduce the risk of heart disease by having a healthy lifestyle. So, all the stuff that we've often talked about in this segment. So, eating a healthy and nutritious diet, staying active, maintaining a healthy weight, definitely no smoking and limiting alcohol consumption.
Yeah, absolutely. Now, you mentioned before there about bones and osteoporosis. Is this one of the reasons why you often hear about women, having fractures, more fractures as they get older, or, maybe having to get onto calcium tablets or something from the doctors?
Yeah, so one of the reasons why this happens is because after menopause, the lower estrogen level actually affects the woman's bone health.
Right.
And so that actually puts them at greater risk of the bones becoming brittle and therefore easier to fracture. Mm-hmm. So on average, women will lose up to 10% of their bone mass in the first 5 years after menopause.
Wow.
Yeah, that's just from the, loss of estrogen. And then after this, it slows down. So it's actually really important to, have regular bone health checks. Now, your doctor, will ask you about your medical history or already know that. Check for risk factors of osteoporosis and then do a bone density test. That's kind of how we find out. Now, unfortunately, Medicare rebates for bone density tests are only available for women with a particular risk factor or for those who are over the age of 70. Mm-hmm. Now, we already discussed that menopause kind of happens around the age of 50. So that's like a gap of 20 years between menopause happening and Medicare covering for that particular test. Now, but personally, as a GP, I think that this is preventable condition that's
Sure.
too important to miss. So I've actually been actively screening my patients who are younger than 70 and sending them for a private bone density scan so that we can start doing something about it before it's too late. The test is probably about $100 or so out of
Yep.
pocket on the coast. So not too unreasonable, but considering the cost of not checking and then developing a hip fracture, I think that it's totally worth it.
Right, absolutely. Now, also in the list there, you mentioned about weight, and of course, obviously with estrogen, a lot of the different changes are going in a woman's body with perimenopause and menopause. Some of the ladies out there can really struggle with weight, can't they?
Yeah, totally. So after menopause, women may notice that extra fat around their tummy area, and this can actually increase the risk of high blood pressure, diabetes, cardiovascular disease, even dementia and some forms of cancer. So for these reasons, it's very important to maintain a healthy weight. And, we've discussed all of this before in terms of like how to do that.
Sure.
But a part of it is that the lowering of estrogen actually creates a mild insulin resistant state, kind of similar to early type 2 diabetes. So it becomes particularly important to watch what you're eating in terms of sugary snacks, processed foods, and carbohydrates to try and maintain that healthier weight so that you don't also develop, insulin resistance and diabetes as well on top of all of this.
Yeah, absolutely. Now, We've talked about this before, obviously, plenty of times, as well as the healthy nutrition, lifestyle factors, no alcohol, smoking, all that kind of stuff. With weight training in particular, how would that go with women? Because I know a lot of women sort of say, "Oh, I don't know, I don't want to look like a man. I don't want to have too many muscles." But I think we do know that from research that having more muscular, or at least a little bit more musculature on your frame helps with that insulin resistance, doesn't it?
Yeah, absolutely. So you're spot on there. And so that's why I encourage my patients to not just do cardiovascular activity,
walking
which
and things
is
like that.
important. Yeah,
Yep.
which is equally important. We
Sure.
don't want to neglect that. But putting in some resistance or weight training is equally as important. We know that muscle helps with overall metabolism to maintain a healthy weight. It helps with all those kind of things to do with digesting sugars and
Sure.
insulin resistance. So not to mention that if we build a good frame of muscle to protect around our bones, we're also giving ourselves a bit more buffer for things like osteoporosis and frailty and those kind of things later on.
Yeah, absolutely. Now, you mentioned that drinking more water is one of the big keys as well. So that's going to affect the bladder, really, isn't it, as well?
Yep.
So how does that work?
Yeah, so because lower levels of estrogen after menopause, this can actually affect your bladder in a number of ways. So it can actually weaken the pelvic floor muscles. Some people can lose the elasticity of the bladder. It can thin out the lining of the of the urethra and the bladder, and so this can lead to more urinary tract infections and things like that. So this can of course then lead to incontinence. So needing to wee when you don't want to. So this could be like while you're coughing, while you're running, walking, sneezing, like those kind of things. This can be embarrassing, and obviously no one talks about it, but, my guess is that it's actually pretty common. Now, women don't have to put up with this. There are continence nurses and pelvic floor physios out there, plenty of them on the coast, who are well trained to actually assess and offer guidance to help strengthen pelvic floor muscles. So, if any of our listeners find themselves in that position, I want to encourage them to not be too embarrassed to go and actually seek help for that, because that can be a game changer in terms of just improving general function in life and your quality of life.
Yeah. So would you need more regular cervical screening and things like that through menopause?
No, so that still remains at every 5 years until you hit the age of 74, at which point the government decides that in their wisdom that the cost benefit for them is no longer there.
Right.
So you'll usually be sent a reminder every 5 years if your results are normal, and then if your results are abnormal, then you'll need more frequent tests, and they'll be guided by your GP. They'll have all the all the guidelines there for them. The other thing to note, though, on cervical screening and those kind of things is that if ever, anyone after menopause suffers from bleeding from their vagina, that isn't normal. So any bleeding or spotting or staining after menopause, definitely go see your GP about it.
Yeah, absolutely. And we've also covered before in our mornings together things like breast cancer, and there is an increased risk, isn't there, in breast cancer with older women, particularly around menopause?
Yeah, that's right. So you'd be interested to know that about 79% of all new cases of breast cancer will occur in women over the age of 50.
So right in that age bracket.
Yeah, absolutely. So it's important to know the normal look and feel of your own breasts. This will help you to notice any changes. So, as useful as it is to kind of come to the GP and get the GP to have a feel for you, you're the best person to know what your breasts feel like, on a regular basis. The best way is to just check your breasts and your underarms while you're having a shower. Look for changes in your breasts, your nipples and your skin, such as any rashes, any dimpling, a lump or any discharge, and notice any new pains that you might have. And then if you're concerned about any of your changes, go and see a doctor. And then if you're over the age of 50 and have no changes in your breast, you should still have a breast screen or mammogram every 2 years. It's still one of the best ways to detect an early breast cancer.
Yep, 100%. Now, what are some of the ways that healthcare professionals treat menopause?
Yeah, look, how many ways to skin a cat, right?
That's right.
So many ways. So we've got some drug-free treatments. We've got some non-hormonal but drug treatments, so requiring scripts. And then we've got menopause hormone therapy, which used to be called HRT. We've got some compounded bioidentical hormone therapy, as well as soy extracts and soy foods and herbal medicine. So we'll try and get through each one. So the first is drug-free treatments. So there are a few drug-free ways to just help with hot flushes and night sweats. So some people may opt for counseling or cognitive behavioral therapy, hypnosis or acupuncture. So, there's some evidence to show that obviously, how we perceive something can make a difference in how we feel about it, how we experience it. So that's probably how those things will work. When it comes to drug treatments that don't involve hormones, we've got some prescription medications like some antidepressants, a drug for chronic pain called gabapentin, and a blood pressure medication called clonidine. They've all been shown to help reduce hot flushes and night sweats from around 40 to 60% when compared to using a placebo. We find that some of these things may also improve your mood and improve your sleep.
Sure.
Yeah. Now, the third is menopausal hormone therapy. So they've changed it from calling it hormone replacement therapy because
it just
long
sounds
story.
better.
Yeah, long story. I won't go into it here.
Yeah.
But basically, it contains estrogen to treat the menopausal symptoms. And for women who still have a uterus, we need to give them progesterone, which is another hormone to protect the lining of the uterus from cancer. So this is by far the most effective at reducing hot flushes and night sweats. Around 80% is the quoted number for how well it works. It also protects the bones by reducing osteoporosis and fractures. And most women tolerate menopause, the MHT or the hormone replacement very well. But some of them may experience bleeding from the uterus or a bit of breast tenderness. So this can be quite safely taken for up to 5 years or up to around the age of 60. Beyond the 5 years, there is a very mild increased risk of breast cancer. And so, that would be at the discretion of your GP and, up to each individual as to what they decide to do beyond that point. Now, moving on, there is this thing called compounded or bioidentical hormone therapy. So these are generally things that are sold by pharmacists or found over the internet. So GPs tend to have less to do with those things. Now, they may contain hormones, but the dose and the safety of the hormone content has not been checked or regulated in these products. So I do have a lot of patients who are on these things. They're often recommended by naturopath or herbalists or various other health professionals. So I don't personally prescribe them because I feel that being a bit unregulated, I'm not sure what I'm prescribing exactly. But having said that, they do work for some patients. So it would pretty much be a conversation that each woman needs to have with their GP if that's the path they want to go down.
Yeah.
Patients also often ask about soy extracts, soy foods. So soy foods and foods enriched in a compound called isoflavones, it's a plant-derived estrogen-like substance. And so, they haven't been consistently shown to reduce hot flushes. But again, a lot of people will, want to try those things because they prefer to go down a more natural path. And again, no issues with that, but just want, I think each woman should, again, discuss it with their doctor. And then finally, there's herbal medicines. And of all the different products out there, black cohosh has been shown to possibly have a mild effect for hot flushes in some women.
Yeah.
Take that as you will. That's what I discovered in my research.
There's a few there to choose from at least anyway, which is a good thing.
Yeah, there are.
Now, what support is available for women experiencing menopause?
Yeah, so my favourite website is Jean Hales for Women's Health. It's a national not-for-profit organisation dedicated to improving women's health across Australia through every life stage. So they work in public health research, clinical services and policy. And on their website are lots of practical and easy to understand information for women and health professionals. So what they do is they translate the research and medical evidence into such a way that it's accessible to a diverse audience. So I would highly recommend their website, which is jeanhales.org.au, and I'll spell Jean Hales for you. So it's JeanHales.org.au. So yeah, I would recommend that to anyone who'd like to learn a bit more. I direct my patients to the menopause section of their website regularly. It allows my patients to come back and have a more informed discussion with me about their symptoms and any of the treatments that they're interested in.
Yeah, absolutely. Look, it's a massive, massive topic, which I thought this is why we need to cover this morning. So, Dr. Clara, as always, thank you so much for joining us. This is Rhema Brekky. Stay with us. More to come right after this.